Our first guest, Prashant Shah, is a global head of AI and lifestyle at Intel and will be sharing the advances in emerging technologies that they are working on to transform healthcare, from IoT to data cloud devices. They are doing amazing work. Over to you, Prashant.
Hi everyone, I'm Prashant Shah. I'm the Global Head of AI for Intel Health and Life Sciences. I'm also an AI advisor for the All of Us Precision Medicine program for the National Institutes of Health. And I'm an AI advisor to the Bill and Melinda Gates Foundation. So today I'll be talking to you about scaling emerging technologies in healthcare. So a couple of disclaimers. NASSCOM does not endorse any of my statements that I make in this presentation. I also will talk about some other companies in this particular presentation that does not represent endorsement by Intel. So I would like to start with the state of healthcare today. Right? There's soaring costs of healthcare. Just in 2021 and 2022, the healthcare costs actually rose in India from to 4.2 lakh crores of rupees, which is a huge amount. A lot of people are having chronic diseases. 1 in 3 adults seem to have chronic diseases, not just in India, but all over the world. The population is aging, so this is putting a tremendous strain on the healthcare system, on how do you take care of the aging population and how do you enable this population to stay at home and receive care at home as opposed to in a care facility. And worldwide, there's a caregiver shortage. This was, of course, exacerbated by the pandemic, and there's a severe caregiver shortage. And globally, it's expected that there'll be 15 million fewer people, or there's going to be a shortage of 15 million healthcare workers by 2030. So these are some of the big trends that are happening in healthcare today. And on the technology side, there are a few different, there are few other trends that are happening. The care is getting more personalized. In this case, using genomics and individual treatment plans, giving the right healthcare to the right people at the right time, so that you don't have downstream healthcare visits or conditions that are caught late. So personalized healthcare, proactive healthcare is something that is extremely important. Consumerization, healthcare being delivered outside the four walls of the hospital. So local clinics or even at the home or on the go. So there's a whole consumerization of healthcare happening. Digital transformation is happening where paper-based records are being replaced by digital health records. There's a lot of data that is being generated through genomics and imaging and wearable devices and so on and so forth. So all the digital data that is being created is driving digital transformation in the industry. There's also a threat around the world around security breaches. Healthcare data is private, and there are laws and regulations that are in place in order to protect the healthcare records of individuals. So this makes it actually a prime target for hackers and ransomware folks to try and target and steal these records. There have been several ransomware attacks where the hackers actually took over and stole a bunch of records and asked for the hospital system to pay money in order to get those records released. And last but not the least, as I mentioned, sort of the digital transformation is driving a lot of data generation. Data can be useful, but too much data, you need a lot of different tools to actually manage the data and convert all that data into insights so that caregivers can actually use the data in a right manner, and patients and even consumers can basically proactively make sense of all the data and take care of their own health. Speaking of data deluge, it's surprising to many people when they hear that healthcare accounts for 30% of the world's data production. This is surprising because you would think that YouTube and all sort of the video aspects of it dominate the data production, but healthcare accounts for 30%. This was published in Fortune, and this is, and the problem is that only 3% of this is, or less than 3% of this is analyzed. And so there's a pretty significant opportunity to actually leverage capabilities like AI in order to make sense of the data. Just one smart hospital can generate up to 59 petabytes of data per year. This has all got to do with imaging and genomics, and these large data sets can smart sensors, videos in hospital rooms, all of that can generate a lot of data. And one smart hospital can generate up to 59 petabytes of data. Another interesting thing is that biomedical research generates up to 40 billion gigabytes of data annually. And this is predominantly driven due to genomics and proteomics and basically sequencing the genome, but also analyzing the transcriptome and metabolomics and all of that. There's a lot of data being generated just for research, and this is quite significant. And so Intel has actually been working with a lot of the biomedical research community to make sense of the data, to analyze all of this. And so we are drowning on with all this data. You really need sophisticated tools and AI strategies, AI and machine learning strategies to actually make sense of all the data. So there are a couple of different architectures as far as analytics goes, and there's a predominant trend towards actually analyzing the data at the source. So you could do the analysis at the source where the data is being generated, or in the cloud where the data is actually streamed from the source onto the cloud, and all the data is basically analyzed in the cloud. So we think of edge as being close to where the data is being generated. So on your left, you see CT scanners and X-ray devices and sensors, and all of that is basically generating the data. And then you have the edge, which is a compute that sits close to the edge, so that you have access to all this data. And then you use a network to actually transmit it to the cloud or the data center. So you could theoretically take all the data that is being generated and push it to the cloud, but that could be a lot of traffic. And unfortunately, most of the data is actually discarded, and only very little of this data actually makes its way to the cloud that is deemed to be valuable. A better strategy or an alternative strategy is also to actually analyze data right at the source, making sense of the data right at the source, so that you're basically minimizing this round trip to the cloud, and you're only sending insights that are important back to the cloud. So you're basically doing one level of analysis at the edge at an individual sensor level or a device level, and then you're doing more of population level analysis at in the cloud, where you're basically taking inputs from various devices and sensors, and then seeing basically trends and managing all this data in the cloud. So how does this translate to a hospital system? So when you think about a hospital system, let's take the case of a CT scanner or an MRI scanner. And let's think of an AI algorithm that is designed to detect brain tumor segmentations in patients. So the hospital, basically the device is actually generating the scans. The scans are sent to the cloud, and let's say the algorithm is running in the cloud, and the images actually make their way to the cloud. The analysis happens, the segmentation, this picture coding on top of the images actually represented the brain tumor that has been found by the AI algorithm, and that scan is then sent back to the hospital with these results of AI analysis. Now, there are a few different considerations when you're doing this in cloud. There are, of course, big advantages to doing this in the cloud, because from a algorithm provider's perspective, you could have multiple different hospitals and all of them sending into a centralized server in the cloud that is actually analyzing these images. So it becomes a lot easier for the machine learning developer to actually keep making improvements to these models, adding new disease states, adding new conditions, and they can rapidly deploy in the cloud without having to worry about how they're going to get compute infrastructure into the hospital. But on the flip side, there's a round trip latency involved. So the data actually has to first of all, be de-identified because patient data is typically considered to be private. And so in a lot of the countries, you can't really just send data to a third-party cloud. You have to actually de-identify these data sets. So that is added burden on the hospital system. The second thing is, you have a round-trip latency where you're sending the data to the cloud. These can be massive files, right? These can be gigabytes of files that need to be transmitted back to the cloud for the analysis. So you need to have strong bandwidth. And while a CT scanner is a fixed device, you have multiple mobile devices in a hospital, meaning handheld ultrasound or portable ultrasound, portable X-ray machines. And the hospital may not have network connectivity, wireless network connectivity, or may have cold spots in certain areas of the hospital where you don't have strong network connectivity to be able to send data to the cloud. So cloud kind of almost always assumes that you have a robust pipe between the hospital and the cloud, and that may not necessarily be true in the case of a hospital. And then you need to have sufficient bandwidth. So this is one specific architecture for analyzing these images in the cloud. The second approach that we've seen is analyzing the data at the source itself. Like I mentioned previously, here the compute actually sits right next to the scanner. It could be an X-ray device, CT scan, whatever it may be. And as the images are generated, the AI algorithm actually runs on a compute that sits right next to the scanner and like does that analysis. So this actually enables a lot of real-time workflows, meaning that the data is analyzed as soon as it's generated. So there's no need to actually wait for this data to be analyzed in the cloud and come back. Right? That round trip can be quite significant, especially if you're thinking about real-time applications like stroke detection and so on and so forth. Moving the data back and forth can take considerable time. You don't have to de-identify images because you're not these images are never leaving the hospital premises. And then you don't have to worry about the network connectivity to the cloud because you're basically doing it right next to the device. So this is just one specific example of brain tumor segmentation. But this kind of there are hundreds, if not thousands, of different applications that are coming out. Brain tumor segmentation is just one of them, and it's used. Brain tumor segmentation again is using MRI. So it's like one modality, one disease state. Some of the other common diseases that I've seen out there are, thyroid nodule detection has been a very popular use case for AI analysis. But when you zoom out and you think about, the space of AI applications that are out there, you can think about different types of imaging modalities. So you have on the vertical columns, you have CT, MR, PE, radiography, and so on and so forth. On the rows, you have all the different types of imaging, whether it's abdominal imaging, breast imaging, cardiac imaging, and you have all these different imaging types. And if you just take, thyroid nodule detection, that's actually just one specific anatomy, which is a lung, using thoracic imaging, using CT scan. And so you can think about, and it's just one particular finding, which is pulmonary nodules. But the lung can have several different diseases that you could be looking for. So you could have various anatomies, you could have various diseases, you could have various imaging modalities. So this space of AI applications is extremely large. And so the real question becomes, how do you actually deploy all of these models in the real world such that you can basically enable rapid innovation? So we've been working with, I'll give you an example of how we are working with GE Healthcare, which is one of the companies that we work with that is embedding all these AI algorithms on the devices or close to the devices on the edge. So, this is a use case of, mobile X-ray scanners. This mobile X-ray scanners have several different AI models on it. One of them is pneumothorax detection, which essentially, as soon as you take a lung image, it checks whether that lung is clipped or not, and then it basically diagnoses whether this particular image has pneumothorax. And then if a patient has pneumothorax, and reprioritization of the workflow happens, where it's flagged that, okay, this is not a normal case. A physician should see this particular case immediately, and the patient, instead of being sent home and then called back again, the patient can be seen by a doctor right away. Whereas if it's a normal image, then the patient can be seen, sent back home. That's just one specific example, and GE is actually doing this with X-ray, ultrasound, CT, MR, a whole bunch of different imaging modalities. So they've created like a common architecture called Edison AI. This is a GE product, and we've been working with them. We have a product called OpenVino, which can take any of the models that are trained to detect certain diseases or certain conditions. You can take it through a model optimizer that makes it highly efficient for these models to run on embedded devices and edge devices. You don't necessarily have huge computing power at the edge. This particular Optima portable X-ray, it needs to be wheeled around from room to room. This is a portable machine, so you can have only a finite amount of computing resources. So how do you actually make sure that these models actually run optimally on these devices so that the radiology workflow is not slowed down, and that this analysis happens in a matter of milliseconds? So it's kind of transparent to the person taking the X-ray. And all of this, there's the Intel processors in here. So we basically optimize, GE optimizes these models to run efficiently on these processors. And as soon as the analysis happens, there's a review done by the technologist or the radiologist. And so I've spoken a little bit of edge computing. There's also a pretty interesting hybrid model evolving where you have a combination of edge computing and cloud computing. So when you think about rural healthcare, you may have certain devices in the rural setting, but you may not really have all the clinical expertise to actually interpret those images, or you may not have a trained workforce to actually make sense of all the data that is being generated at the edge. And so we've also seen a lot of use of teleradiology, where the images are taken, analyzed close to the edge, and if a condition is found, then it gets uploaded to the cloud. And then a more qualified physician in, let's say, a city center hospital can then actually take a look at these images and actually provide their analysis on these particular images. And so that's a combination of using edge and cloud in a teleradiology type of setting. That basically brings me to telehealth. It's a broader topic. I won't have a lot of time to dig deep into this, but this actually really took off when COVID-19 hit. It was hard for patients to visit physicians. It was, physicians would be taking on risk if they were seeing a lot of patients. And so how do you actually give care remotely to patients who without having the patients to come into the hospital or the clinic to see them? So virtual visits, telediagnosis, virtual ICU. There's a company called Medical Informatics Corporation that can create a pop-up ICU, and you can have monitoring across various rooms, and the physicians don't have to go into the rooms to take a look at all the different monitors or vital signs. You can see it on a big dashboard in the safety of a room, so that they can basically prevent themselves from getting infected with COVID-19 and so on and so forth. So a lot of different use cases, but I really want to actually talk about some interesting use cases that I've seen more recently. Again, this slide is showing products that Intel does not necessarily endorse, nor do I know how efficacious all of these different products are, but these are really interesting advances that I've been tracking, and I thought I would share with them. So KardioMobile is developed by a company called AliveCord. This is a consumer device, really small little device that you can actually put two fingers on it, and it basically gives you clinical EKG that can be used to diagnose various diseases. So that's one. People are using ordinary HD cameras to actually figure out how the patients face subtle changes in patients' blood going into the face and going back can be detected using camera, and you can figure out the respiration rate and the heart rate of the patient just using simple ordinary cameras. So there's some research that's happening in this space. Wound care has been another interesting use case where a wound can be analyzed for how fast it's healing using just a cell phone. You can also figure out sort of teledermatology, where you can take a picture of a mole and figure out whether it's a cancerous mole, or you can do some sort of preliminary diagnosis on this. Virtual visit therapy, people have accidents, people age, you want to be able to, people are using 3D cameras to actually figure out the range of motion, whether the range of motion is improving, not improving, and sort of the exercise at home, and being able to use AI and be able to actually see how the patient is progression. Urine analysis kit, you have a dipstick and you insert the dipstick in the urine, and the urine actually, the dipstick actually reacts with the urine, and you can do chemical composition analysis. So you just take a photo of this particular slide, and it gives you the analysis. So this is at home, you can do urine analysis. And then of course, pediatric ophthalmology, where you can actually figure out if somebody has a lazy eye or farsightedness, nearsightedness. So there's a company that is actually creating a product around this. So I would like to actually stop over here. I think I've run out of time. Please feel free to contact me on LinkedIn or follow me on Twitter. I'd love to continue this conversation with you. Thanks for this opportunity. Have a nice day. Bye.
Hi. As we heard from Prashant, a lot of emerging technologies are coming. The Indian health tech industry is pursuing and building world-class healthcare products from India, not only for the Indian market, but also for global markets.